Greetings from Washington, D.C. This is Peter Thomas. I'm the General Counsel of NAAOP. Well, the election is just weeks away, and healthcare is on the ballot. There's no question that the outcome of the 2020 election will have a major impact on the healthcare policy that we will be dealing with over the next four-year period. The Biden camp has detailed plans on healthcare. They put out a very robust platform around healthcare. Among the key elements of the Biden healthcare plan include a reduction of the age in which people may become eligible for Medicare down to age 60 from the current age of 65, as well as the creation of a public option that would allow individuals who are uninsured to purchase health insurance instead of on the state or federal exchange, to purchase them through a public option run by the federal government. The goal being to create additional price transparency and competition and reduce the overall cost of healthcare while increasing access to health insurance. Senator Biden, or I should say former Vice President Biden, also intends to try to reduce the price of prescription drugs and shore up and defend and bolster the Affordable Care Act in a number of other ways. The number of the uninsured has risen in the last several years, and there are ways to improve the Affordable Care Act to address that problem. The Trump administration, the campaign did not put out a formal platform this year, so it's a little unclear as to exactly what to expect in the next four years from a second Trump administration regarding healthcare policy. But some things are pretty clear. The continued push to reduce regulatory burdens across the board, but in particular on healthcare providers, it would be expected to continue. There's good and bad elements to that. But overall, providers don't like unnecessary regulation. And so that's ultimately a good thing in the end. There are some risks to that, of course. The Trump administration also is interested in trying to continue to reduce the cost of prescription drugs, although I must say that not a whole lot has actually been accomplished on that goal over the last few years. The same with surprise medical bills. There have been legislative efforts to rein in surprise medical bills, but not a whole lot has occurred. But the president has spoken specifically about that issue and intends to continue to press forward with it in a second term. Most notable, I think, is the status of the Affordable Care Act. Since 2010, the Congress has voted something like 82 times to invalidate one or the entire aspects, multiple aspects of the Affordable Care Act. They came closest, Senate Republicans came closest a few years back when John McCain, if you recall, cast the deciding ballot not to overturn the Affordable Care Act and invalidate that law. The Supreme Court has looked at this issue at least once and created a landmark decision where Chief Justice Roberts cast really the deciding vote to maintain the validity of the Affordable Care Act, and really said that if Congress wanted to change it, they would. There is now a new Affordable Care Act case before the Supreme Court, and that case will be heard on November 10th, 2020. So that is at least one reason why the Senate Republicans are so interested in getting Judge Amy Coney Barrett appointed to and grant their consent to appoint her to the Supreme Court as soon as possible prior to the election. That case involves a Texas ruling that said ultimately that the Affordable Care Act, because Congress had eliminated the tax penalty for failure to have health insurance, i.e. the individual mandate, that therefore Congress did not have authority under their taxing power to pass the Affordable Care Act, and the entire law should be struck down. That is what the Texas court ruled. That ruling was stayed or held until the Supreme Court could consider the case, and the Supreme Court will now consider that case again in early November. A decision is not expected until June of 2021. It's important to know that the new court will be primarily a 6-3 conservative majority. And of course, there are strong voices that would wish to invalidate the ACA. I personally, and I've looked into this quite a bit and studied some legal scholars who have examined this question. It's more likely than not that the court does not strike down the entire ACA. That's an 1,100-page law. The individual mandate is a critical aspect of the law, but the real legal issue involves the issue of severability. Will the court see its way towards striking down that provision within the Affordable Care Act, the individual mandate, without eliminating the entire law? Can it sever that provision from the rest of the law and maintain the sanctity of the Affordable Care Act? That's the most likely outcome, but there's no guarantees. And with a 6-3 majority for conservatives that have been accommodating to challenges of the Affordable Care Act in the past, it's anyone's guess whether the Affordable Care Act is maintained or not. What does that mean? It would be a really tumultuous ruling if the Supreme Court essentially dislodged 10 years of implementation of the Affordable Care Act in the US healthcare system. It would be almost impossible to turn the clock back. And that's one other reason why it's unlikely the Supreme Court would go to that length. But it's not impossible. They could invalidate the exchanges. That would essentially eliminate pre-existing conditions and other insurance protections that go along with universal coverage, like protection from lifetime and annual caps, community rating, and other non-discrimination based on health status in the health insurance market. They would also eliminate about 20 million people from coverage under expanded Medicaid programs and the state and federal exchange or exchanges that were created as a result of the Affordable Care Act. Again, this is a draconian response. This would be a huge development. I don't think it's quite likely. It certainly is possible. And that's one of the reasons the stakes are so high, not just in the vote for this new justice, but also, of course, in the election of 2020. Generations before us, many millions of Americans have fought for the right to vote over the last two centuries. It's incumbent upon each of us to vote on November 3rd, or beforehand if your state allows early voting or mail-in voting. So NAAOP encourages everyone, the entire profession, your families, your friends, to get out and make sure that you cast your ballot on November 3rd. Thanks so much.